All right.
All right. Welcome to the Mint Condition Podcast. Today we've got an amazing guest, Dr. Steve Baker, chiropractic physician. He's one of the owners of Axcess Accident Center. Man,
Yes.
I almost got a tongue tie.
Hey, we did that just so people would, have that confusion and get their tongue tied every time.
You misspell stuff on your advertisement, right, to get attention?
Yeah.
Right there. It'll work.
AXCESS, Axcess Accident Center.
Yeah. So, Dr. Baker, you and I have known each other for a couple of years now, right?
Yeah.
Man, I'm super excited to chat with you about this. Today we're going to be talking about excellent care,
Yep.
right? People need to understand that when they're injured, there are other answers out there. People
sure.
say, I've tried everything. Yeah. So I'm excited to chat with you about that. First, before we dive into that, tell me about your background. What got you into becoming a chiropractor and what got you so passionate about this?
Yeah. So I was lucky and grew up with some chiropractors. My mom and my dad, and then my sister also became a chiropractor. My grandpa was a chiropractor as well on my mom's side. So a lot of chiropractic in the family. And so I was very fortunate to have, an in-house chiropractor. How nice is that?
Yeah. That's great.
Yeah. There were some options I could go. I could either go into kind of tech back in the day. Tech back in the day was a Nokia, with the snake on the phone. That was the tech back then. Or I could go into chiropractic. Those were kind of like where I was looking at. And chiropractic for me was awesome. My parents would come home. They're fulfilled helping people feel better. We didn't struggle to eat for the most part as well, which was nice. So went the chiropractic realm, and it's been amazing, right? How cool is it? And you know this as well, to be able to help people with just your hands, right, to make them feel better.
Yeah.
And it's you don't need some special tool to do that, and it's pretty amazing. So chiropractic's been fun. It'll be 19 years in a couple months for me.
That's fantastic.
Having been a chiropractor, and been just keep adding things as the years go on as well, to add more tools into the toolbox for helping people as well.
Well, and I think not just on yourself, right?
Yeah.
You're adding skills, things you can do with your hand, and what you can teach your patients, different things, laser, acupuncture, different treatment approaches, but also your team. You've got an amazing team, the energy there. What have you done to inspire them to follow in that same passion that you have?
Yeah, so people may have remembered this time called, they call it like the COVID era. I don't know if everyone's heard of that. But back then, things kind of transformed a little bit. We specialize in auto accident rehab. People stopped driving as much. And that was kind of interesting. How do you treat people in auto accidents if no one's driving? So it was kind of like not a full rebrand, but we had to look at ourselves again to see what is this world going to be like, right? So in that moment, we actually just kind of rebranded, kind of restructured our culture. Our culture was okay, but I don't think it was going to carry the day, right? So myself and then the other owner of Axcess Accident Center decided to go forward and just say, hey, we're going to build something that's just totally incredible. So we created a blueprint with a company helping us through that process. And in the end, our culture, our mission, I guess our kind of brand statement is living your extraordinary life, right? How easy is that to just focus on that, right? There's not some long mission to remember at that point. From there, we kind of created like who we are for the community, who we are for patients, who we are for our team. And from there, we have our blueprint, which has driven our culture now for the last 5-6 years now. And that's really transformed who we are and what we focus on and what we look at with each step of the way. So that's where we're at, is living your extraordinary life. If a patient's like, hey, I just want to be able to walk again, that's living my extraordinary life. Great, we can do that. Or someone's like, hey, I want to climb Mount Kilimanjaro. Great, that's your extraordinary life. Let's do it.
Yeah.
Wherever they're at, we want to meet them there and take them there.
That's awesome.
Yeah.
I like that you're living what you teach.
Yeah.
So it seems like what I'm hearing is you guys don't just try to provide that for patients in the community, but even your own staff. You're like, what's your extraordinary life?
For sure.
My extraordinary life is working from 2 to 8 p.m. because I want to go snowboarding every morning.
Yeah.
Right?
There you go.
Let's set that up.
Yeah.
Let's make that happen. And I think it shows through. So you talked about living your extraordinary life. Man, that's a long word.
It's a big one. Again, tongue twisters.
Yeah, right.
We put all of that in everything we do.
Yeah, I guess if we're going to do a podcast, I got to learn to loosen up my tongue. So if you guys are doing that and they just need to walk or whatever, what kind of barriers have you run into on people giving up and not trying to reach that goal of living that way?
So actually just reviewing a case now, I get to, I don't know how many depositions you've got to be in your lifetime yet.
As few as possible.
Yeah. But I get one, have one teed up here in a couple weeks, and I'm reviewing the records. And in there, literally, we stated the patient's ready just to close their case because they've been treating for so long and not having resolution, right? And in the end, they ended up getting surgery on their neck and all this other stuff, right? But people do get stagnant in care. I'm sure. I mean, everyone at some point is like, do I really want to continue even working on this? I'm so done. The easiest one, I think, most everyone can look at it this way. Like, how many people have tried to lose weight, but you just can't do it, so you just give up.
Yeah.
And they're like, oh, I've tried everything. Well, you probably haven't. Same thing happens in medical care as well, or getting better with injuries. It's like, oh, I've tried everything, but you just really haven't. And it comes to just not knowing what's available, right? We've seen many people come in, and that's why we've also added things to our toolbox in our clinics, like ozone injections. People are like, what's an ozone injection? Oh, well, we're going to inject O3 or oxygen into kind of a trigger point, to an area where it's sore, or where a muscle's not giving up or relaxing enough. And it literally has changed people's lives like crazy. Like, I've been dealing with this for years. I've done massage, I've done chiropractic, I've done acupuncture, I've done PT, I've done steroid injection. I mean, the whole gamut of things. I've done drugs, whatever. And then that
medicine,
shifts it.
Drugs.
Yes,
just
of
in
course.
case people are confused.
OTC drugs. So whatever they can do that's legal in their state. It's interesting when you introduce that to them and they actually get relief. That's why I love what I do, right? Why I love being someone who can heal people. And that's why when people say, oh, I've reached my maximum medical improvement, or I'm like, have you? Have you really reached your maximum? You've done everything. You've changed your diet. You've done every Eastern medicine type thing. I mean, there's lots of rages right now about psilocybin and all these different things. I mean, there's just so much out there. Have you really reached your maximum medical improvement, or have you not found the solution to the issue at hand? So I would say living your extraordinary life gives us a realm to look beyond our borders, even inside Axcess Accident Center. If we're not getting someone better, great, send them out. We don't have the key to unlocking their health, in a sense, right? We have a lot of keys. We just no place is going to have all the keys.
Yeah. I love that. You got to work with the community. So let's break a couple of those things down.
Yeah.
First off, ozone injection.
Yeah.
I think I want to get people's minds to open a little bit.
Okay.
If you don't know what something is, don't write it off.
Yeah.
Okay. I made that mistake early in my career. Cranial sacral therapy. Wrote it off. Phooey. The chiropractic adjustments.
Yeah.
It was like, that doesn't do as much as chiropractors think.
Yeah.
No, it does. Right? Like there's a lot of value there. And so you have to actually go and experience it. So ozone.
Yeah.
I just got ozone a month and a half ago.
Awesome.
For the first time. So I injured my knee and we're doing an assessment. We know what's wrong. My ACL has been stretched and elongated, but I have all this pain on the inside. Yeah. Right. And the chiropractor recommended that. Gone. One set. He's like, it's going to take 6 to 8 sessions. One session. So apparently I just respond, well, everybody's different, but absolutely love it. So what helps you know when to apply that? What kind of injuries?
Yeah. So, man, I mean, you could do it to most injuries, right? But people don't necessarily want to pay for an ozone injection every time, right?
It's faster.
It's definitely faster.
And what are the negative side effects? Corticosteroids, not great.
Not good. Ozone? ooh, we might cause a little more oxygen in that area. Are you allergic to oxygen?
I'll have to check.
Okay.
I'll go get a test.
A
Don't
test.
They do those like prick tests?
Yeah, for oxygen. Yeah, sensitivity.
Sensitivity test.
Yeah, there is the only thing that I know of, and this is so rare. You'd have to have a lot of ozone injections. You can have a Herxheimer's reaction, which is kind of like a detox reaction to too much ozone. Yeah. So, but it's kind of like you feel sick. Like a flu-ish type feeling.
But that's a lot of those.
A lot of it.
Yeah.
Yep. Or kind of irritation at the site. But dude, ozone is amazing. Helps with the pain, helps with decreasing inflammation, hyperoxygenating an area. Our bodies thrive on oxygen. Try not breathing for like 30 minutes and see what happens. It's usually not a good outcome.
Well, and a lot of treatments we do, red light therapy, cupping, it's all about blood flow.
It is.
Why blood flow?
There's
a lot of factors.
Is there oxygen in your blood?
Yeah, exactly.
Yeah. Okay.
That's why, right?
Yeah.
So I've been quite impressed.
Yeah.
I wouldn't say I wrote it off, but I was skeptical.
Yeah.
Right. And there's nothing wrong, I think, with being skeptical of any treatment, but try things out for yourself.
Yeah.
And then the next thing I want to talk about is how do we help more providers in our community? Because it is easy to get stuck in our own buckets, maybe think we can cure everything, or hyped up on our own Kool-Aid.
Yeah.
How do we help more providers to open up their minds to recommend more things, maybe to collaborate more? You guys have done a ton of that. What do you guys do to encourage that, not just in your own company, but in people around you?
Yeah. So one thing that I would say, and we work with a lot of different providers, we always tell providers, come in. If you ever need anything, chiropractic, ozone, acupuncture, we want you to experience it in our clinic so you can have an idea of what we might be able to help if you have any clients that fit into that realm, right? And then that allows for people to experience something different than what they're always used to. It's kind of like, let's say you just go into McDonald's all the time and you're like, man, they just have the best quarter pounder. It's the best burger I've ever had, Have you ever had anything else? No. Oh, okay. Well, and is McDonald's the best? Oh, it's the best. Nothing can beat them. Have you tried anything else? Dope. Okay. So maybe try, I don't know, Five Guys and see what happens. A little bit more expensive, unfortunately. But it does taste a little better.
Yeah.
Okay. Similar things, you could say similar thing for steaks too. Have you been to Sizzler? Oh, their steak's amazing. Yeah. Have you been to Ruth's Chris? Oh, hello.
Now we found it.
Different realm, right? So if we're allowing ourselves to step out of the realm that we've always been in, and especially if it's not going to hurt us, like ozone, not going to be a problem. A good chiropractic adjustment, not a problem. Don't go to someone who's crazy, right? But be conservative and light with the adjustment maybe the first time, right? Just like there's good and bad in all professions. It's all around, right?
Yeah, we've talked about that a good amount on our podcast because there are really good physical therapists and really bad ones who are cookie cutter. Yeah. Maybe a YouTube video would be better quality, right? Same thing chiropractors, same thing surgeons who just want to cut anything up.
Yeah.
And
they should have been a chef.
Yeah, they should have. One of my favorite things, research behind surgeons is one of the main risk factors for getting back surgery is your zip code.
Oh.
That's a bad thing, right?
It's not good.
Yeah. So definitely, like you said, look for the right chiropractors. Look at reviews, they're great. Yep. But even go in and interview them. I love when patients are like, well, before I see you, I want to interview. And they're a little defensive because most people aren't that, I guess, straightforward or aggressive. Yeah. I'm like, have at it, please. Every patient, I would love it. Come interview me, interview 3 other physical therapists. Yeah. Find the person that fits you, your style.
Totally.
And this might be a little weird, but I tell my patients on their first visit, it's okay to fire me. It's okay to find somebody else because I know I'm not the right fit for every single person.
Exactly. Yeah. And as providers, we try to fit as many as people as possible, but there's people that have not liked me, and I mean, I like myself, so why doesn't everyone like me? It's okay. We're not going to be a fit for everyone, but if we can at least help them make a difference where we can. And then what's great is if you know another provider that might be a fit for them, send them over, send them over to them so they at least get the care that they need. That's all we can do.
I think we need to emphasize that, to get outside of your bubble. I love that you're like, any provider, come try it, so that they are aware of what that experience actually is, what their patients might be getting. And if you're a provider out there, if you're a physical therapist, chiropractor, MD, pain specialist, you need to, you're a disservice to other people. And you might be like, I don't have time, or I lose money if I refer out. Then you're the problem.
Yeah, if you're like, I gotta hold them to keep my money coming in, that's not the best paradigm to live in, per se. It's not going to provide full abundance, I would say, if you're interested in having an abundant practice, per se.
You have to have an abundant mindset. If you are focused on patients come in, do an assessment, and not think, what can I do for this patient, but who is the right help for them on every patient, I promise your practice is going to be slam packed. Because every patient is like, Brad, help me get to Steve. Right? And Dr. Baker had all the answers. That's great. And they're going to trust me when they have another injury or anything else. So let's talk about MMI. Most people don't know what that means. I enjoy quizzing people, like in our own staff, on different terms. It's max medical improvement, right? So what has been the biggest barrier for patients when they do tell you they've hit MMI? They might not use that term, but you know what I mean.
Yeah, it's kind of, like the LOL, it's the MMI, just the medical MMI code, Well, one thing, and this is, if providers are listening to this podcast, I would just say, kind of consider that there's another realm of MMI, another way to say MMI without saying it, because if you go up in a case and the adjuster says, oh, they reached MMI, you literally have take it out hold on, you're telling me let's say I say that, as a chiropractor, they've reached their maximum medical improvement. You're saying that all medical that's maxed out? I don't really have the right to say that, per se, right? I don't think any person has the right to say that, any one provider.
It's a pretty big ego to feel that confident in that.
In how we approach it, we say the patient has reached a stability point with chiropractic care, or with what we're doing on our side.
Right.
Now, stability point for us is they're not retracting, but they're also not improving, right? So they've kind of met their stability point, but that leaves room for something more, right? And so inside of our stance that you've never really tried everything, then they go to PT. Maybe it's surgical. Maybe it's what's the next thing? Maybe you need pain management, injections. Maybe you need I don't know what.
Some leeches.
We don't
know.
Hey,
and that's why they have panels and groups of doctors get together and discuss cases, and they'll help brainstorm and come up with those ideas. I love that. I think people get caught in their own head. Some good examples are like fibromyalgia or chronic regional pain syndrome, that it becomes a label. It's part of my identity. And it's hard to ever make progress or make any substantial change because people are stuck on that. So when you when you feel stuck, when you feel like you've hit that level, talk to more people. Ask more questions. I love when someone says, I've tried everything. And I go, okay, so how did you respond to ozone therapy? What's ozone therapy? Like, okay, so you haven't tried everything. Well, I've tried everything else. Okay, what about acupuncture? What's acupuncture? Like, okay, you haven't tried everything. Like, let's look into some different options.
Exactly.
One other very important part is that providers need to refer sooner. The treatment fatigue, what you talked about, like this patient was working on their case and they're just hit fatigue. Did we get enough other people involved? If in your case, they've talked to a surgeon, they've talked to you guys, physical therapy, whatever, then treatment fatigue and what we're doing isn't working. We haven't tried everything necessarily, but they're fatigued. But when somebody's like, I did just chiropractic for 8 months or just physical therapy for 8 months, I'm fatigued. Can we just close my case? Or I'm just done even trying. I just don't play sports anymore. Then it might be the provider's
They don't need sports to have a good life.
Right. Quality of life, right? But that's our job. And other chiropractors, physical therapists, MDs, we need to be more proactive at assessing that case. I was just talking with Brad Powell from Foundation, and his group, by 2 or 3 weeks max, if they're not seeing progress, they're getting other therapists in their group involved. They're referring outside to a chiropractor, another PT group.
Yeah.
They're very proactive about that, which is really smart.
It's awesome.
Yeah.
Yeah. That's if that's the setup for people, you're going to have so much more success. And why not go home and sleep great at night knowing you've helped more people versus, well, I kept them in my network and made an extra buck.
Yeah.
You know, like that's I don't know. I guess if you got into it to be, super rich and wealthy, then maybe you should have went into pharmaceuticals.
Yeah,
I don't know.
surgery.
Well, yeah, it depends on what type of surgery you want to go into.
Yeah.
But just something that would provide you as much money as possible versus as much fulfillment as possible.
Yeah.
Yeah.
I like that mindset.
Yeah.
So we talked about ozone injection.
Yeah.
Can we talk about acupuncture?
Yeah, for sure.
So what's your background in acupuncture,
Yeah.
and when should people consider using that?
Yeah. So background in acupuncture, again, my dad was a chiropractor and also taught acupuncture as well. So I've been around acupuncture a ton in my life.
What does it look like when he teaches that?
So teaching, it just depends. So he's taught United States all over. He's been in Africa, Europe, all over teaching back in
Is
the
he
day.
at universities, chiropractic programs?
Just through
or-
chiropractic, like
That's
Logan
cool.
University and so forth. Doesn't teach anymore, but
Right.
he taught in his
That's
day,
cool,
right? And then I took acupuncture from Dr. Yinny, who was in Kansas City. He was a huge chiropractic acupuncturist as well. Great guy. But I also teach now acupuncture as well, which is super fun and fulfilling with my brother-in-law. But acupuncture is amazing. So usually with people, if something's not relaxing or something's not jiving through the chiropractic, or they're like, oh, I just have let me just backtrack. So acupuncture, let's set this up. Acupuncture by I think it's the AMA or some health organization that you would think would never say anything about chiropractic. It's the World Health Organization.
Who?
I forget who. Acupuncture treats 2,000 or over 2,000 different symptoms, diseases, whatever. Okay, so acupuncture is crazy awesome, right? So literally, if you have something, likely I can treat it with acupuncture. Okay, and acupuncture itself too is just working with working with meridians, energy channels, chi, and working with the points on those meridians, right? So there's thousands of acupuncture points all over the body as well. It's actually lots of different meridians as well. You can get pretty in depth, and there's a couple of different ways to decide what points to use versus formulary versus looking at someone's pulse, tongue. You can actually graph the points too. There's actually you can actually see the energy on the points using a probe and so forth. So there's lots of ways to treat people and get crazy effective results.
And these aren't just musculoskeletal injuries. These are...
Yeah. So it could be musculoskeletal. It could be anxiety for people. So in our office, let's say we've done anxiety. I just was talking to actually my wife's friend the other day, and she's like, I think I saw you back in the day for when I was trying to get pregnant. And I got pregnant, like that. It worked. And
That's
it's
cool.
funny because sometimes I'll treat people and then I don't see them back. But then years later, oh yeah, I got pregnant from getting treated with acupuncture because it does help with fertility.
Yeah.
Right. There's very specific points for that and for balancing the body. The whole basis of acupuncture is balance. The yin yang sign.
Yeah.
Balance through everything.
That's really cool.
If the body's balanced, it will work at its most effective level. Right. So acupuncture is pretty crazy. So with motor vehicle accidents, injuries, and the side of that, we see PTSD, anxiety, obviously pain, headaches, also digestive issues sometimes from different anxiety, different things, or if they've been injured in the abdomen from the seatbelt and so forth. So there's a whole range of things that acupuncture can help balance out with. Even also with insomnia, people have insomnia after auto accidents too, whether it's from having nightmares of getting an accident or just the pain itself or the racing thoughts, because if they've had a concussion, then the brain is all shifted and different and everything else. So there's so many things acupuncture helps with. It's incredible, right? So we could it feels like you could market for all of that stuff, right? We try to stay in our realm as chiropractors, but I'm always like, tell me everything you got going on. If we're doing acupuncture, let's hit everything.
Yeah, might as well.
Yeah, it's an extra needle to fix that anxiety, let's do it. Not a problem.
So there was Dr. Worley was on another episode with us. He's a functional neurologist. And I think the same concept applies here. So with a lot of his stuff, it's like patients aren't getting better because they didn't fix the brain. We're just treating a symptom instead of the injury.
Exactly.
Or sometimes it's two injuries, but the brain is necessary for everything else.
Yeah.
Seems similar to that, where no matter what you're getting treated for, you're like, I sprained my ankle, I tore my ACL, or I was in a car crash, especially because of the anxiety. There were a couple other ones that you mentioned.
Anxiety, PTSD, there's concussion, all that stuff.
That's the one I was thinking of. So PTSD is super common with it. I have patients who won't go drive.
Yeah.
They're months and months.
Yep.
So we get them with mental health, which is great. That's a really good option. But this might be something else where you're getting treated for your injury, maybe working with mental health. Let's use the acupuncture to help create that balance.
Yeah. And then the other thing too, if you can't get out of fight or flight, you can try and do that in your brain, but you literally are having a lot of things happening in your body, that your brain thoughts can't really overcome at the time.
Too much stimulus.
Yep. Acupuncture can help bring all of that down. We also use another thing in our clinic. I feel like we're not getting off topic, but we offer a lot, I guess, right?
Yeah, that's all right.
We also offer alpha stim. And so this is a brain alpha wave creator that you just clip onto the earlobes. We put people on that with acupuncture for PTSD and anxiety. They walk out like, what's up? Like they're just like,
all natural, no negative side effects, right?
Yeah. I mean,
just don't drive for a little bit.
Well,
after.
You make sure you're awake.
Yeah.
But people report like, dude, I slept so good, after I got the sun. Heck yeah. And they're like been struggling with sleep. So there's so many things. I mean, I doubt everyone has heard of alpha stim. Again, something you haven't heard of, right? And it's actually FDA cleared to treat insomnia, anxiety, and pain. Those are the three things that's FDA cleared to treat because they've done so many studies. So
alpha stim's fantastic.
Yeah. So there's just a lot of opportunity for people to actually get the healing they need if they're willing to just take a look or talk with a provider that actually cares about them seeing an outcome. This is a great example too. Speaking of providers that want to see a great outcome, one of my friends has had high blood pressure for the last year or so. He's been going to this one provider and they're just not really doing what there is to do on it. And then so he just started to a new provider. The new provider's like, what? They haven't done this. They haven't done this. You might have a cyst on your kidney. You might have this. You might have this. You might have this. He's like, no, they've not checked for any of that. He's like, well, your cardiovascular health is amazing. Your beats per minute's like at 50. Everything looks good. The only thing is your high blood pressure, which is weird. So it's like you're not. Normally we'd say, oh, it's this, this, and this, and that's why you have it. But there's no reason or rhyme for this. So probably 2 months ago, I'm like, dude, if you ever just want to try acupuncture for high blood pressure, there's literally specific points for it, like high blood pressure points. And he's like, okay, I'll let you know. So he did finally hit me up when he went to this new provider. And the new provider's like, yeah, there's something more. So we're 3 sessions in. His high and low are down about 15 to 20 points. Nice. And it's right after we do acupuncture.
And sustainable.
Yep. And
that's great.
And I haven't talked to him. Well, I guess it's later this week now. I need to talk to him and see. We haven't seen him for a couple days now, but he did 3 sessions and he's like, this is crazy. I'm like, I know. I'm like, I should probably do it on myself.
Yeah, right.
Keep my blood pressure low.
This is something we have to highlight.
Yeah.
Our health industry is all about making money.
Yeah.
How about we live healthier?
Yeah.
How often are we out walking? Mm-hmm. Are we eating the right foods?
Yep.
Do we drink enough water? Sleep.
Yeah.
Oh my goodness. Sleep is not expensive.
Yeah, it's not.
It's free.
Yeah.
Go sleep.
Yep. The other thing too, which was funny, and I know acupuncture will help, but he's like, when he did acupuncture, he's like, oh, and I did this breathing thing too. I heard breathing might help. I'm like, yeah, it helps with breathing. Breathing helps with high blood pressure, literally.
Oxygen and breathing techniques.
Have you done breath work? It's not hokey. It literally is good. Again, let me reverse back here the last 20 minutes. Try not breathing for 30 minutes and see what happens, Breathing is so vital, and even in Chinese medicine, acupuncture, we breathe in the qi, we breathe out the bad qi. I mean, there's just like a lot of stuff with qigong and all those different things that, and they can just totally alter your whole body system. There's more out there than probably most people or myself probably could even comprehend of abilities to heal and get better.
Yeah, and I don't know why there's such a, I don't even know the term, but there's a stigma about breathing.
Yeah.
Or well, that's just weird. Yeah, it's weird because nobody does it.
Exactly.
It's not common, but it is normal to have controlled breath. When you're laying down, you're not using your full lung, right? I've been doing a lot of things to help change habits. And if you do 25 deep, fast breaths, it resets your nervous system to be ready for a new pathway.
Yep.
And so there's a lot you can do with breath and with needles. You put needles in the right spots and everything calms down. When your system is not working, it's hard to fix it. And we're going to just keep throwing surgery and meds at you because we make money off, we as in the medical field. But if your car is misaligned, go ahead, put new tires on it.
All you need is new tires.
New tires.
New bearings.
New tires, new bearings. And maybe let's change out your engine just because. Who knows? It might affect it.
It could help.
Instead, fix the alignment. So same thing with acupuncture. Fix the alignment of your body. Fix the balance in your body. I love that. That's what people need to do more of in general in their life is assess your whole setup. Hours of sleep, water, all that stuff. And then look for balance. Look for treatments that create that balance.
The other thing too that's kind of, I feel like it's trending more and more is nervous system regulation. I don't know if you've been hearing that, a little bit more. But if you can regulate your nervous system to bring down everything and calm everything, you can heal. You can't heal like in a flight or fight state. It's just your body's not even focused on healing. It's focused on what? Surviving, right? And if you feel like, oh, I'm just surviving, well, probably you are. So why don't you regulate that nervous system, bring it down? But and acupuncture is definitely an amazing way to do that. Chiropractic also is, clearing out the nervous system, taking away the interference, of the nerves from the spinal alignment being off, right? If you want to go the subluxation route and everything else that's going on through the chiropractic realm. But there's multiple ways to clear out the interference, clear out what's not working and get the body working properly so you can live your extraordinary life.
Yeah, I love that. Well, more people in our community need to get in, see providers like you and your team where they can interview you guys. Come and ask questions about it. Try out new treatments and live your extraordinary life. Organize it. Create a plan.
We're just again, we've talked the whole time, but we're just super passionate about people having what they need. One thing that's cool too, I'll mention this, our Provo clinic just hit 1,700 Google reviews, which is incredible.
That's awesome.
Currently the most reviews.
1,600 of them were paid for. But
no, go read them, and there's some great stories in the reviews of what's happened.
I've been to that clinic. Fantastic setup. Your staff are super friendly. When I was there, I got invited. Great experience, by the way. But then I got invited right away. Like, hey, if you're having a good experience, tell people. And I love that. Like your team want to share that message, and it shows there's a passion behind doing a good job because we want people to tell people about it.
Yeah, for sure.
That's awesome. 1,700. Congrats, man.
Yeah. So we got to keep growing because we want to keep our status. I mean, I guess I should chat GPT this or have AI look out for me. But I'm pretty sure we have the most Google reviews in Utah for chiropractic.
For chiropractic?
For a clinic,
Nice. I'd be curious how, like, other industries and stuff, that'll be fun to look at. That's awesome.
We'll have to get that on a billboard,
Oh, that'd be so cool. I really like that idea. Okay, so I really appreciate you helping us out. Like, sharing with the community and helping. I really want Utah to live healthier. Right? So I appreciate that insight. I think you have a lot to share. Love to have you on again sometime. Share more of your insight. 19 years, right?
19 years.
That is awesome.
So crazy.
Yeah, all that experience to share with everybody.
Yeah, I literally am like, so thinking like, that doctor's been around for 25 years. It's a long time. And then I was like, wait, I'm a couple years away from that.
You're right up
there.
I'm
right, get up there. It's pretty fun.
That's cool. So we like to ask everybody as the last question, what does a mint condition life mean to you?
Yeah, I would say mint condition. I mean, I think that falls right into living your extraordinary life. If you're not getting able to do the things that you love or want to do, there's no reason to not strive for that. You're either moving towards your mint condition or holding it or moving above it, or you're letting yourself kind of go down the path of not having what you really want, right? I see older people, even my parents, they aren't in their mint condition anymore, and it's sad because they've waited to live their life too, for a little bit later. And I would say mint condition is living life fully, having fun. You've seen I go on vacation every once in a while. Yeah. I'm just super passionate about it. I want to live my life now. And while I'm in my mint condition, it is harder, it's true, to hold up mint condition when you're 90. Okay, yeah. The body does eventually wear out, like a really nice vehicle, it does wear out.
Yeah.
But if you can strive to do everything possible, the investment now in your health, the investment now in your body can just allow you to live in your mint condition as long as possible. So I would say just, you wake up every morning and you don't have to hop out of bed, I guess. But hopping out of bed, that's part of being mint condition, I think, without screaming in pain.
Yeah. You're getting out of bed with purpose. You're ready for that day.
Yeah.
I like that. Live life on purpose.
Yeah. And I would say, I guess the other part of mint condition is having everything set. Your mind, your attitude, your mindset ready to go for that, your health, your body, and then kind of your intention of what you're going to kind of go out and fulfill on or help out in the world.
Yeah, that's great.
Yeah.
Really good insight. I appreciate that.
Yeah.
So last thing, how can people reach out and find you guys? Website, phone number, what's best?
Yeah, we have all of those. Website, axcessac.com, so axcessac.com. That's our website. Phone number, 801-701-8222. That reaches all 4 locations from Spanish Fork, Provo, American Fork, West Valley. And those are the kind of the best ways, I guess, to reach out.
That's awesome.
So, yeah.
Well, I appreciate it. Thanks for coming on and sharing your insight.
No problem. This has been a blast for sure.
Awesome.
Yeah, thanks.